What sucks about being a chiropractor?
Well, after all these years, I love being a chiropractor. But the goal of being a chiropractor is to help people get well. That's the bottom line, helping people heal, helping educate, motivate, empower people to get better, to live healthier lives and lifestyles. But again, we're in a society that we're dealing with this blockage or interference, and one of them is insurance. So insurance, it would be nice if insurance paid for everybody, but people want to be here and have this kind of therapy, all alternative therapies, yet the insurances tend to be difficult with what we do. There are some insurance companies that work well with us, others that don't. So that's definitely a block in dealing with it, and I have to deal with it and speak to insurance companies all the time to try to get people benefits, but it's certainly a challenge. And the other part is people not knowing what we do. That's a real challenge. 10% of the population statistically only have been to chiropractors. 90% have no idea what we do, or skeptical of what we do, or afraid of what we do. I can only have them come in here and experience that and then make the decision for themselves.
Okay.
That it's really nothing like what they've heard about. But unfortunately, that's what's been out there. And even regarding pain, it's only about pain, whereas my practice is about getting rid of pain but restoring wellness in people's lives, getting people healthier. Those are the two challenges, I would say.
Okay. Tell me about quacky chiropractors.
Well, there's good and bad in every profession. All right, there's good dentists and bad dentists, and good doctors and bad doctors, and good chiropractors and bad chiropractors. As a matter of fact, when I first started in practice, or actually before, when I was thinking of going to school, people said, "Why would you want to be a quack?" And that was what I heard, and I didn't understand it, but I certainly have heard it enough times, and it's unfortunate, but it's somebody that's qualified and educated and does their certifications and is a good chiropractor, then there's no problem with any form of quackery. Anybody that's really not above board and confronts their patients and talks to them about what really we're capable of doing, well, that's a form of quackery, but that can occur, like I said, in any profession.
I went to a dentist not too long ago, and the dentist found something that wasn't perfect. And I could see in her eyes deciding whether to tell me it was an emergency and I had to come in because it was going to increase her revenue. One of the big issues with chiropractic work is that your business model requires people to come in often. Tell me about that.
Great question. We want people to be here because they want to be here. I can make a recommendation as to what I think is needed to get a person to go from point A to point B, which means wherever they're in pain, to get them out of pain. Once they're out of pain, they make the decision as to whether they want to continue with wellness care. So that would be the only reason for continuing somebody. I don't continue to treat somebody if they're still in pain. Obviously, what I'm doing is not working if that's the case. So once somebody gets from point A to point B, pain to no pain, okay, now it's decision time. What do you want to do? Do you want to continue to come in to maintain what we've corrected and also really be educated and motivated to change your life and stay flexible and stay loose? Or I'm done. I feel good. If I need you, I'll call you.
Okay.
So it really is up to you. It's again about a choice. I only want people here that want to be here.
Right.
That's a key.
Great.